We are seeing about the management of physical symptoms in the patient receiving palliative care. We will see about the constitutional symptoms. Constitutional symptoms arise due to problems in various organs or systems in the body. One of the symptom exhibited due to constitutional factor is anorexia. Anorexia is where the patient does not experience hunger or the patient does not feel like eating food. Anorexia is a reduced desire to eat. Often it is associated with taste changes. So, a taste change is a naturally occurring phenomenon. When a person ages, the number of taste buds reduces and therefore the taste sensation also reduces. Now, when the patient is terminally ill, obviously they may be in old age or due to different types of therapies received, the number of taste buds may undergo changes, variations, and this can affect the taste sensation in the individual, leading to anorexia, which is the reduced desire to eat food. Causes of anorexia are often multiple. It could occur due to cancer, pain, or due to disordered taste and smell. Cancer, stomatitis is the inflammation of the oral cavity, sores in the oral cavity. A malodorous ulcer or fungating tumor. So when there are lesions, ulcers in the oral cavity, which causes bad smell or off odor, it is called as the fungating tumors. Gastrointestinal cause is listed here, and it includes stomatitis, inflammation of the oral cavity, ulcers in the mouth, xerostomia, dryness of the mouth, mucositis, inflammation of the mucous membrane, infection in the gastrointestinal tract can compensate or can reduce the desire to eat. The patient may not feel hungry or they consume only very less amount of food. Esophagitis is infection of the esophagus. Dysphagia is when there is abnormal or less amount of hunger is called as the dysphagia. Small stomach, the volume of the stomach reduces, could be because of gastrectomy. Gastrectomy is the surgical removal of a portion of the stomach. When there is a malignancy in the stomach, like a tumor or a cancer, and if they are surgically removed, the capacity or the volume of the stomach reduces, and this is called as the small stomach as a result of gastrectomy. Linitis plastica is a cancer of the stomach. Gastric compression, when the stomach is compressed or the gastrointestinal tract is compressed because of hepatomegaly. Hepatomegaly is enlargement of the liver, and ascites. Ascites is accumulation of the fluid in the abdominal cavity. This can compress the gastrointestinal system, leading to anorexia. Gastric distension can occur due to delayed gastric emptying. Gastric emptying is the food that is consumed should pass from one portion to another portion, and when there is delay in the passage of the food, flow of food or the intestinal content from one part to another part, it can cause gastric distension, which will lead to anorexia. Bowel obstruction or constipation, hepatic metastasis. Metastasis is when there is carcinoma of the liver or liver diseases due to chemotherapy or abdominal radiotherapy. All these can reduce the intake of food, leading to anorexia. Intracranial diseases such as metastasis, radiotherapy, and infection. Metabolic, when there are abnormalities in the sodium and calcium level of the body and also glucose level of the body. Organ failures, like when there is liver failure, kidney failure, or adrenal gland failure, it can cause anorexia, infections, medications, psychological factors such as anxiety, depression, confusion, dementia. All these are psychological factors. They can also lead to anorexia. Organizational, when the poor food preparation or presentation, when they are restricted to a hospital or a home or a palliative care center, and when the food prepared is not like what they expect, then the amount of food intake reduces drastically. Or it can also occur due to religious or the cultural customs. Management of anorexia: if the patient has nausea, give treatment for nausea and anorexia can be relieved. Pain, if the patient experiences pain, uh, give appropriate treatment to relieve the pain and other symptoms. Reduce psychological distress if the patient has any, with proper support and counseling and guidance. If they have depression, treat it. Preferably not using the selective serotonin reuptake inhibitors, as it can increase anorexia. For depression, this is the drug that is used, SSRI. They are used for treating depression, but at the same time it will also increase anorexia. Therefore, do not opt for giving SSRIs. Treatment of anorexia is important because it will improve the patient's morale, means their attitude, their well-being will be improved. It will reduce the anxiety among the family members, and it will also help to preserve the optimal nutrition, and it may delay the onset of cachexia. Cachexia is abnormal weight loss is cachexia. When the patient does not eat food, and automatically the patient becomes malnourished, and there is weight loss in the individual, leading to cachexia. Treatments: treat or palliate the underlying cause. If possible, give activities or exercise, and dietary modifications can be given. Dietary advice: the assistance of a dietitian may be valuable. The food should be visually appealing. The taste and the smell of the food should be good, and small meals can be given, and the patients can be given what they want and when they want. So whatever type of food they like, such kind of foods can be given, and they can be made to sit in a table, and encouraged to eat with the other members in a room where there is no which is free of odors. Usually when we eat in a hospital setting, we know the smell in the hospital, the smell of the medicines, and whatever cleansers they use, all these, they give a peculiar smell in that setting. So where the smell of the room could be modified so that it is free of odors. And appetite stimulants can be given. Appetite stimulants are those that will improve the appetite of the individual, like small amount of alcohol. Corticosteroids can be given, and progestogens can be given, and the patient has to be explained as to why they have to consume food to remain healthy, to avoid weight loss, and because they are taking different type of medicines, they have to have adequate nourishment. So such explanation should be given, and they should be given appropriate counseling. Counseling in anorexia is a very important component. Anorexia and poor food intake frequently cause distress for the patients and the families, and therefore it requires careful discussion and explanation. So the patient has to be explained about the importance of consuming a healthy, balanced diet. When advanced and progressing cancer is the cause for anorexia, it needs to be explained that enteral or parenteral nutrition will not be of benefit. So in advanced cases of cancer, then they have to be explained that they have to consume the food, and the parenteral nutrition alone is not sufficient. The next condition is weight loss and cachexia. Causes of weight loss. In patients with advanced cancer, this is primarily due to alterations in the protein, carbohydrate, and lipid metabolism caused by the inflammatory cytokines released by the tumor. So the cytokines are the biochemical compounds that are released by the tumor, and it will interfere with the entire metabolic process of the body, and it will lead to deprivation of nutrients to the body, and the tumor or the cancers, they will utilize these nutrients for their growth and development. In patients with AIDS, acquired immunodeficiency syndrome, it usually relates to systemic infections and chronic gastrointestinal dysfunction. While in the case of patients who are HIV positive, it is related to the infection and related to the dysfunction of the gastrointestinal system. The causes of weight loss include malnutrition. Poor intake due to anorexia can cause weight loss. Functional blockage, mouth, esophagus, and stomach. When there is blockage, tumors, obstructions in the esophagus or the stomach, it can cause weight loss. Malabsorption can also lead to malnutrition and weight loss. Vomiting, diarrhea, and fistulas can again cause malnutrition. Protein loss due to ulceration, hemorrhage, and repeated paracentesis. Paracentesis is when repeatedly when the food tries to move through the obstruction, it causes ulcers, hemorrhage, and as a result of which protein loss, and it can lead to malnutrition. Metabolic abnormalities secondary to cancer can cause cancer. Cachexia is the extreme loss of weight. Increased energy expenditure. When more energy is used by the body, as in systemic infection, chronic fevers, and tumor metabolism, they use more of energy, and therefore it leads to weight loss in the individual. Treatment. The treatment options for weight loss include correct or palliate cause of malnutrition and anorexia. You just find out what is the reason for the weight loss and try to correct that, and treat the tumor wherever it is possible. Drug treatment. There is no satisfactory drug therapy for cachexia and weight loss. Corticosteroids and alcohol may reduce anorexia, but they have no effect on the metabolic abnormalities of cancer cachexia. Progestogens may exert an anabolic effect and reduce or prevent weight loss. Dronabinol is effective in maintaining weight for some patients who are HIV positive. Dietary measures. The patients can be given small frequent meals. They can be given what they want and when they want. Dietary supplements can also be given to improve weight. Enteral nutrition. Enteral nutrition is tube feeding. Will not reverse or prevent cancer cachexia, and it may be appropriate for patients with upper gastrointestinal obstruction or who may otherwise suffer starvation. So if there is any obstruction in the upper part of the gastrointestinal tract, so such patients can be given enteral nutrition. Enteral nutrition may cause fluid overload, abdominal cramps, and sometimes diarrhea. Parenteral nutrition is intravenous feeding. This will not reverse or prevent cancer cachexia. Is appropriate for patients who are temporarily unable to eat. So it can be given only for a short period of time. It cannot be given for a long period of time, for up to 2 weeks or more, because of anti-cancer treatment. So parenteral nutrition or intravenous feeding can be given to patients only for a short period of time. It is associated with significant complications, and also it is costly, expensive. Management of the psychosocial consequences can be done in order to prevent weight loss and cachexia. Counseling is very important for both the patient and the family. Progressive weight loss and cachexia represents progression of the disease. So as the patient starts losing weight and the weight loss is aggravated, it indicates that the disease is progressing in the patient. Counseling and discussions may facilitate acceptance and understanding that The weight loss in the individual is because of the disease progression. The family needs to be dissuaded from trying to force the patient to eat. So when a caregiver is there and when the caregiver sees that the patient is losing weight in spite of eating, they will try to feed the patient more. So this should be avoided, as this will only cause physical distress and guilt in the patient. The family needs to be helped to show love to the patient by means other than feeding them or pressurizing them to eat. So the relatives and the friends of the patient should not show their love and affection in the form of food or forcing the patient to eat more and more, because this may cause distress in the patient. Weakness and fatigue. Asthenia is the generalized weakness present among the patients, and it is associated with fatigue and lassitude. Lassitude means lack of energy or strength. Causes. In palliative care, asthenia is most frequently associated with progression of cancer or any other underlying disease. But other causes need to be considered, as some are amenable to treatment or palliation. Most relatives attribute weakness to poor eating or due to medications. So the general weakness among the patients has various causes. It could be neuromuscular, cachexia-related loss of muscle mass, cachexia-related muscular dysfunction, polymyositis, that is inflammatory myopathies. Myopathies is related to the degeneration of the muscles, overactivity, prolonged immobility, polyneuropathy, degeneration of the nerves, intracranial tumors, paraneoplastic encephalopathies, encephalopathies, degeneration of the brain, parts of the brain, acute confusion or delirium. Metabolic cause could be due to electrolyte imbalance, dehydration, renal or hepatic failure, kidney failure or liver failure. Endocrine causes like adrenal insufficiency, deficiency of the adrenal hormones, ectopic adrenocorticotropic hormone secretion. So sources other than the pituitary secreting the ACTH, diabetes, malnutrition, inanition, that is the exhaustion caused by lack of nourishment and malabsorption, anemia, infection or some of the causes. Psychological causes include anxiety, depression, dependency, boredom, and insomnia. So all these can make the patient feel very weak and fatigued. Anti-cancer therapy that is given for in the form of radiotherapy or chemotherapy or interferon. Drugs such as opioids, the tranquilizers, sedatives, and the antidepressants that are given to the patients, and the diuretics, antihypertensive drugs that are given to reduce the hypertension, hypoglycemic that are given to reduce the glucose, and the other drugs can cause weakness. Treat the underlying cause wherever possible. Drug therapy can be given in the form of corticosteroids. Symptomatic improvement is possible when they are given corticosteroids, and there is a improved feeling of well-being. Proximal myopathy can occur with continued therapy, and amphetamines and methylphenidate can be given to treat this condition. Physical therapy encourage exertion and activity and physiotherapy, so they can be encouraged to do light activities within the patient's physical limitation, whatever they are limited to, whatever space they have, whatever is possible, whatever physical activities are possible that could be done by the patient. It may help to maintain the dwindling muscle strength, because the muscles become stronger only when there is activity. When the patient does not do activity, the muscles become weak. Encourage activities providing diversion from the patient's feeling of weakness and assistance with the activities of daily living, So they can be encouraged to do their own work, like dressing up, brushing their teeth, eating by themselves, and physical aids. Reorganization of the immediate environment to accommodate reduced mobility. So whatever space they have, whatever limitations they have, so that could be rearranged to encourage them to be physically active. Supportive therapy in the form of physical and psychological therapy is necessary. Redefinition of goals and expectation is also necessary.